Good evening, Lawrence.
Good evening, Rachel. And thank you so much for covering the treatments for COVID. The story has so moved on to vaccine that the treatment story is being left behind. And I have friends and loved ones who've recently gotten infected, been dealt with, gotten in and out of a hospital. And the treatment issue is still obviously extremely urgent.
It really is. And the numbers are trending in the right direction now in terms of deaths and hospitalizations and new infections. But we're still tens of thousands of Americans are getting infected every day, even on our best days now. And if you have mild to moderate symptoms and you are at risk of advancing to serious illness, what we're hearing from the top science advisor to President Biden on these issues is that people need to ask their doctors about getting these monoclonal antibody treatments, the same treatment that Donald Trump got, frankly. It is something that generally is of no cost to the patient. It's reimbursable. Medicare, for example, is covering it. And almost 70% of these doses are going unused because people don't know about them. But they really do show strong clinical promise for keeping people from needing to be hospitalized and for keeping people alive.
Yeah, that was the big news of your segment for me, is that they're available. You do not have to be someone who worked for Donald Trump in order to get them.
Right. And because of the way this was handled in the Trump administration, we think of these as like things that you have to have Jared's cell phone number to be able to get. Yeah. And it's just not true. There are hundreds of thousands of these doses out there. The government has made them available at no cost. The administration of them is something that has to be arranged through your local doctor. But it is worth asking, if you know anybody who's within 10 days of getting symptoms, who isn't hospitalized but is at risk of severe illness, ask about these treatments.
Important reporting, as usual. Thank you, Rachel.